we're talking a lot about unexpected costs that might come from starting up a practice or just a business in general. Do you have any past history, I guess, or any examples of an unexpected cost that you never expected that might be something to anticipate for somebody else?
Before we get to that, I'd say the strategy I used when starting the nonprofit entity in 2007 was I took a half-time paid position with the county, so I knew I would have some income and would get some benefits covered while I was building up the practice. And that was a great way, and I think it's a great way for all mental health clinicians, right? The reality is that it takes time to build up your practice, whether you're going cash or taking insurance. There's things you can do that we'll talk about to get clients and referrals faster, but you're not going to be immediately full the day that you start your practice. So
right.
There are a lot of opportunities now, thanks to telehealth groups all throughout the country, that people can sign up with and work as a contractor or employee to have that guaranteed income. And if you need to get benefits covered and don't want to get that set up right away through your own business, getting a half-time job or similar somewhere else is a great way to make sure you can pay your personal rent while you're building up your business. The problem I had by not making a business plan was, we got to a point where I was full in the practice and had one therapist on board, and then they started part-time also, and then they were full. And then we had started generating a wait list for the clinic of people who wanted to be seen. And then in my mind, I thought, oh, hey, I've got 50 people on the wait list. Time to go hire more employees to see these patients on the wait list.
Right.
So I posted, and there's several mistakes here, but I posted for a W-2 salaried position, and I hired another physician. And physicians can be expensive employees. So if you go right out and hire a full-time physician, that's a lot of money that you have to put on that person's paycheck. And my assumption was, well, all these people on the wait list, that will fill this person's schedule. But when I went back to call all the people on the wait list, and this is what happens in mental health, and this was youth mental health, wait lists don't tend to translate into immediately scheduling for appointments, because it's always the time to catch patients is right when they call.
Right.
And so I had falsely assumed, hey, I can fill this doctor's schedule, no problem. And then when I went back to call those 50 patients, maybe 3 of them took appointments. And so then I had a full-time employee generating not much revenue, but I was still responsible for their salary. That had not been thought out in a business plan. That was not part of the budget, and that caused some serious hardship. So that was a unexpected expense that if I'd been more thoughtful about the business plan, could have maybe avoided it. But I certainly learned from that experience.
Yeah, and I mean, a lot of it is we can read as much of this stuff about, or we can read as much of this as we can in a book or listen about it on a podcast. But some things are just learned through experience of doing it and taking the chance. And I mean, it sounds like that was a really tough experience in the moment, but all in all, panned out positively in the end.
Yes, yeah, it did.